gentlemen, boys and girls, children of all ages, welcome to the Big Top.
There's something about the circus that seems magical. People and animals doing things that are dangerous, defy gravity, and seem impossible. For a 6-year-old girl, a trip to the circus is filled with wonder and anticipation of what will come next. It's larger than life, unexpected, and jam-packed with a wild range of emotions. Under the Big Top, you can go from laughing your head off to holding your breath in fear in just a matter of seconds. For 6-year-old Leona Mendoza, a trip to see Barnum & Bailey's greatest show on earth took the words impossible, unexpected, and fear to new heights most lion tamers, high wire walkers, or trapeze artists could never imagine.
Ladies and gentlemen, there's been a horrible car crash.
When I was going to the other lane, I just saw a truck in front of me head on. And I tried to move the steering wheel, but it was too late.
They were struck head-on. Irving Santos was driving his wife Sarah, stepdaughter Liana, and 1-year-old daughter Bella to the circus in Laredo on June 28th of 2012.
Bella was in her car seat in her baby carrier at the time, and Liana was sitting down on the regular seat with her seatbelt on.
Liana had been filled with anticipation. She couldn't wait to see the animals.
Elephants, like the tigers, and also the ponies.
Just before the crash, they had taken a quick phone call.
We said we're on our way because we wanted for them to do the petting zoo.
Irving hung up, and the next thing Sarah remembers, she was in the emergency room of a community hospital in Laredo.
I can remember that he was telling me that it was a miracle that we were alive, that everybody was okay, and just that my husband was the worst one.
I shattered my tibia and fibula. I broke my femur, and my left, that was on my right leg, and I broke my left knee.
As bad as he was, somehow he remembered his mother-in-law's phone number.
He didn't want to tell me what exactly had happened because I guess he didn't want to worry anybody. So that was the worst, I guess, call that I got in my life.
Liana's father also got the call.
My mom said Liana was at the hospital. And right away I just changed, and when I got to the hospital I saw her there. And the nurse told me everything was fine, but when I saw the bruise, I knew something was wrong.
Remarkably, Bella was just fine. Sarah had a concussion and a significant cut on her head.
They kept me and Bella till about 2 o'clock, and then they released me and Bella, and they had told me that Liana was gonna stay there, but because she was complaining of abdominal pain, and she was running a little bit of fever.
The next day, Liana didn't seem like she was getting better at all.
I just knew that they were keeping an eye on her just to make sure, and they didn't tell me anything. They were just, she's okay, she just has abdominal pain.
On the following day, as Irving went into surgery for 6 hours, Liana was worse.
I checked her. I was gonna give her a kiss. She was super hot, and when I picked up her to see her belly, she had like bumps on her belly.
And she would never ever talk at all. We would ask her a question and she would just nod her head or yes or no. So we knew something was wrong.
Her fever hit 105. They took her for another CAT scan.
When they had came back from the CT scan, she started vomiting blood.
The doctor called to tell them her intestines were ruptured.
She's gonna need to be flown to San Antonio, but right away.
The hospital in Laredo had requested a transfer for Liana to University Hospital, the only pediatric trauma center in South Texas.
When we got the call about Liana, it sounded like she was very, very sick. And so we wanted AirLife to bring her in as quickly as possible.
Because of her concussion, Liana's mom could not go with her on the AirLife helicopter.
I told her bye. I told her I was gonna be waiting for her when she got out, that she was gonna be okay, that she was gonna go with her dad.
She was a little bit scared. I was scared too, but I just wanted to get to San Antonio as quick as possible.
At University Hospital, they were preparing for a worst-case scenario.
Even before she came here, when we got the phone call about Leanna, we knew that she was in what we call septic shock.
Liana and her dad landed at about 1 a.m. on July 1st, 2.5 days after the crash.
They were waiting for her, and then they just started asking me questions and asking the helicopter crew questions. And then they told me it's gonna be, the doctor told me we're gonna take her in right now.
She was alive, but in critical condition.
Not only did she have an infection, but that infection was causing her body to shut down.
It all happened so fast for Miguel Mendoza.
I remember they brought her a Cookie Monster, I think, yeah, a Cookie Monster, and she took it in with her. Yeah.
As Sarah and her parents made the drive up I-35, Miguel paced the floors, waiting for news from the operating room.
So when we got Leanna to the operating room, everything looked just as bad as we had expected.
They addressed the most urgent injuries first.
The main thing we try to address initially is bleeding. We try to stop all bleeding. And with all the intestinal injuries, she had a significant amount of bleeding as well as holes in her intestine.
She also had a significant damage to one of the main arteries going into her left leg.
Problem with that particular injury was that she also had intestinal injuries, and so she had intestinal content within her abdomen, and there was no way really for us to fix that artery. We had to use blood thinners to keep that artery open in hopes that it wouldn't completely clot off.
She was counting on the odds to be in Liana's favor.
If that artery completely clotted off, then she would have the potential to lose that leg.
They already knew that if Liana was strong enough to survive the massive infection, she'd be back to OR many times in the coming weeks.
So in terms of priorities, definitely it's life over limb. And so we did everything we can to try to stop the infection from getting worse, to try to stop the bleeding.
Sarah and her parents arrived at about 3:30 in the morning. The next 3 hours went by so slowly.
Praying and praying. That's all I could do.
At about 6 a.m., she was out of surgery. The news was as good as it could be.
They just said that they were going to try their best and that she was a strong little girl, that she's made it this far.
Back in Laredo, Liana's stepfather finally began to wake up enough to understand what had happened.
It was hard because I wanted to be with her over there, but I couldn't because of my situation.
Dr. Liao knows it often takes days, sometimes weeks, for parents to recover from the shock.
I think we always try to reassure them, but without giving them false hope.
She told them this was just the beginning.
When patients are so sick like Leanna, we can never finish everything at one operation, and we do what we call planned takebacks.
She had 10 more operations over the next couple of weeks.
For us, it was pretty straightforward in trying to manage her injuries, although they were relatively complex and took multiple teams of surgeons and a complex anesthesiology resuscitation effort, as well as a critical care resuscitation effort after the surgery in order to get Leanna through the whole process.
In between these operations, they left her abdomen open, but protected.
With injury, there's a lot of tissue swelling, and so we weren't able to close her, but we did protect the belly with foams and dressings over it, so that essentially the belly was protected. It wasn't open to air or anything like that, but that's why we keep them sedated and in bed.
After the second surgery, her blood pressure took a nosedive.
They made me leave the room. Yeah, it was so hard for me. I just didn't want to lose her.
I just couldn't believe it was happening. So I just started praying and said, please God, please don't take her away from me now.
As scary as it was, because of Liana's serious condition, it was not unexpected.
Sometimes with kids who come in septic shock from injuries from their intestine, what can happen is they can have periods of high and low blood pressure that need aggressive resuscitation.
I still have flashbacks on that day. I still don't know how they managed to stabilize her that day.
They kept her in a medically induced coma.
If I would call her name, she would wake up. And that's what kept me going. Because anybody else could call her and she wouldn't respond. When I called her, I would get next to her and I would say, Liana. And she would turn and open her eyes and look at me and go back to sleep.
With every operation, he hoped and prayed.
Because they would take her in and we're going to close her and she would come back and we couldn't. But when they closed her up, I said to myself, she's going to make it.
As Liana was allowed to start waking up, Dr. Liao finally got to really meet her patient.
Well, I didn't get to know her really for the first 10 days that she was in the hospital because we had the breathing tube in her. So I knew her injuries, I knew her parents. But I think anytime you get a child like that you take to the operating room every other day,
her personality emerged, and everyone in the pediatric ICU fell in love with her.
Despite everything that she had to go through, she had a really good spirit, and she never threw a tantrum. She always let us do the dressing changes or look at her wounds without causing a great fuss. She just let us do things, and then when we were done, she went back to being a happy 6-year-old, which that we don't see every day.
Liana had been waiting to tell her something important.
First thing she said to me was, I want to listen to Justin Bieber. And that was a bribe that we always used every time we wanted to examine her or do a dressing change on her.
Unfortunately, as Liana was allowed to get up, she complained of a particular type of back pain.
So at that point, we went back and reviewed all the CT scans, and none of them showed an injury. But the point of being at a trauma center is that you have experts who know injury patterns of children.
They knew right away she needed an MRI.
And so when we did that, we saw that her lumbar spine had a distraction injury that needed surgery.
She was allowed to go home after about 6 weeks. It was August 6th, her stepfather's birthday.
All of a sudden, I just saw them walking through the door, and I just started crying.
Liana's family is so grateful to Dr. Liao and the entire trauma team at University Hospital.
I knew she was doing a good job, and she did a good job. All of the doctors that were in the team, they did what they could, and it worked.
There is a difference between a trauma center and a community hospital.
The main thing that a trauma center has is the resources that's not available in a community hospital. And, from having several teams of trauma surgeons in-house to having multiple teams of anesthesiologists, pediatric intensivists, and an unlimited supply of blood banking.
It was an entire team focused on every aspect of Liana's care.
And she had great nurses in the PICU who reassured her. They got her a Justin Bieber poster, life-size. I walked in one day to her room and there it was. I was like, was he really that tall? And everyone got to sign it. And I think those things took focus away from the injury and let her focus on something that she enjoyed.
The PICU team also saw the love and support of Liana's family.
She was never alone in the ICU. Either her mom, her dad, or grandma, somebody was always in there with her, holding her hand. And I think that's an important part of care.
But it's been difficult for Liana. Due to the extensive damage to her intestines, she's been living with a colostomy bag this whole time and taking blood thinners for the clot in her artery. It's tough for her mom to have to say no to swimming and other things she was able to do before the crash.
And telling her, you know what, baby, you can't go outside. You can't sweat. You can't run. You can fall. If she cuts herself, since she was on a blood thinner, it's very hard for me to stop the bleeding.
As amazing as her recovery is progressing, is the tremendous strength and courage of this little girl.
She hasn't really let that get to her. She's never came home crying. She's never came home complaining. She's just been really strong about it.
And every time I see her in clinic, she's more and more like a 6-year-old child rather than the patient that I had. I think I think that's special.
Dr. Leah will take Liana back to surgery in June to take down the colostomy, so she'll be back in the pool in July. But there are still concerns.
Her artery still has a partial blood clot in it, and we think that over time as she grows that the blood flow down to her leg won't be enough. So we're monitoring her. If at some point she needs a bypass, we'll do that.
For her family, it's all about giving Liana a chance to grow up.
Even though I'm her stepfather, I'll be there for her.
Their dreams for her are simple.
And try to be all she wants to be, all she can be. And all her hopes and dreams, whatever they might be, for them to come true.
Hoping that she'll be normal again. She won't have any problems when she gets bigger. That she doesn't have to remember anything.
They want her to have fun, to dream about marrying Justin Bieber and becoming a singer. Knowing that she is loved beyond measure.
I'm so proud of her. It's like, I thank her for saving my life. She saved my life that day. Because without her, I'll be lost.
Keeping families whole and seeing kids like Liana come back for visits looking better and better, that's what it's all about.
I mean, I don't think you can put words to how that makes you feel, or how it makes you feel that an entire team of people worked so well together to get someone who most people would say wouldn't make it through an injury, but then they come back to see you in clinic, and you can see the whole clinic light up, and that just adds to how rewarding it is to have the job that we do.
Ladies and gentlemen, children of all ages, in center stage, fresh from her death-defying journey, please welcome the star of the Big Top, Liana Mendoza, with the sweetest words a trauma team could ever hear.
Thank you for saving my life.